So sleep apnea and snoring are absolutely related. What tends to happen when we're awake, our airway is open. The muscles are working all of the time to maintain a good airway for breathing. When we fall asleep, all of those muscles tend to relax and allow the airway to become a little bit more narrow. Typically, as those muscles relax, sometimes you get some vibration, and that is what we hear as snoring. That's the vibration of the muscles in the back of the throat. For some kids and adults, particularly if they have other problems, for example, large tonsils and adenoids, which can narrow the space a little further, as those muscles relax further, the space gets very narrow. So at times, the snoring is very loud. Often children are working quite hard to breathe because their airway is narrow. And at times, in fact, that airway can block off completely, which is what we call an apnea. It's kind of a breath hold. And then the body has to wake itself up to restart the breathing. Most snoring is quite similar, but the sounds can vary a little bit between one person and the other. Generally, snoring is quite a defined problem, and it's very much the vibration of the muscles at the back of the nose and at the back of the throat. Some can be a little higher pitched and some are a little lower, but typically it's that vibrating type sound. You can make other airway sounds, but in fact, as children's ENT surgeons, we learn to use sounds to help predict where the problem is. So typically other parts of the breathing airway, if there are problems there, they make different sounds. So really, snoring can vary a little bit, but typically it's quite isolated to the nose and throat area. To some degree, it's a little bit due to that all of us are put together slightly differently. Our exact size and shape of the back of our nose and the back of our throat is a little bit different. Also, the length and the shape of our neck varies a little bit, which means that for some people, even when they're asleep, their airway is wide open and there's no sound. But for some of us, there is some snoring with a little bit of vibration. And to some degree, that is normal. However, for some people, there are other factors. For example, as I mentioned, children with large tonsils or adenoids, but it could be other aspects such as a very blocked nose or possibly nasal polyps, for example. Snoring on its own is very common. It's estimated that probably 5 to 10% of the childhood population snore to some degree. And if it's just snoring, then it poses no health risk at all, and it's very reassuring. However, snoring can be an indicator that there are other breathing problems going on. So if the child is snoring, but the breathing is comfortable, so by that there's no work of breathing, the child is not sucking in the neck, their chest is not working hard with their muscles, and they're not sucking in under their ribs, and the breathing is very calm and comfortable, then I would be very reassured and usually no treatment is needed. However, for some children, we notice the snoring because it's loud and that it's a marker of other problems, such as when they fall into a deeper sleep, the muscles are relaxing further and further and the child is struggling. When this is happening, the body has to keep waking itself up in order to normalize the breathing and ensure there's enough oxygenation to the body and to the brain. My analogy is often a little bit like an adult. Somebody might poke them in the ribs every 10 or 20 minutes all night. They may not necessarily fully wake up, but their sleep can be very disturbed. And that is a bit like sleep apnea in children with bad snoring, so that the body has to keep waking itself up in order to resolve the breathing. But the difficulty and the problem is that the sleep quality is severely disturbed. This wakening process often makes children very restless and very sweaty, and often goes with some gasping events after they've been holding their breath. So when it reaches that point, then I have more concern, and usually we treat the problem. So there are various sleep disorders. I deal with the breathing related sleep disorders. The first one is really very rare. It's what we call central sleep apnea. And that is actually a problem with the signals coming from the sleep center inside the brain, which controls the breathing. So that is something I look after with my colleagues, but it's very unusual. In reality, the majority of what I see is sleep apnea, although it is a spectrum. Some children may only have it at times if they have a viral upper respiratory infection, for example. Some children may have it a lot of the time, even when they're well. So it's a spectrum called sleep disordered breathing. And at the more severe end, it's what we would call obstructive sleep apnea. I think we as adults, and particularly those with children, we understand that sleep is vitally important. If we've had a child waking us up several times overnight, we really don't feel well in the morning. We lack energy. Sometimes our concentration can be really affected. That applies exactly the same to the children, but I would say even more so. Children are growing, they're developing. So certainly those for whom their sleep is disturbed, and I see that a lot with children with sleep apnea, it can affect their concentration, their memory, their behavior. A lot of people describe a very labile mood. So at times they're very happy and at times they're very upset. Sleep allows neurocognitive development, so really brain and physical development. So I would say it's possibly one of the most important aspects of childhood growth.